Thus, we typically have had this virtually, but we are honored to have here our Director of Public Health, Dr. Memark, for our update. Good to see you.
Go ahead and we can get started. I'll give you your update for today. All right, so what we're looking at, so you look at the curve on the right and then our cases that we have. So we're going in the right direction. We have 171 cases per 100,000 right now, and that is definitely a good sign. But remember, it is still over what's considered high transmission, which is 100 per 100,000. So we are still almost double. So we're not clear, but we are heading in the right direction, and hospitalizations also support this. Next slide, please. When we look at positivity rate, this is also, we use a few different data points in conjunction with each other to know kind of the state of our COVID pandemic. And so right now we have a 3.2% positivity rate, which is excellent. So remember, we want that under 5, and we really start getting concerned when it gets closer to 10%. This is only the PCR numbers, but it's still very helpful for us to know. It's kind of a barometer of what's happening. Next slide, please. We continue to see deaths that trickle in, and so our most vulnerable still continue to succumb to this virus. So we're up to 1,053 deaths have been confirmed and presumed from COVID-19. Next slide, please. This is one of the topics I just want to touch upon briefly is the variance. I've talked about this before, but we continue to see the rise in the variance that we have throughout the country and throughout the state. If you look at that kind of yellowish mustard-colored bar, that's the B117 variant. That's the one that originated in the UK. You can see from January up until just last month how that is increased. And so this is not the only one. We have we have a lot of variants you can see on the right, but we have multiple ones that we're concerned about. There's the one from New York and the one from California as well. Now the one from India has also risen to a variant of concern at this point. So it continues, so you'll see in the country, it's about almost 60% of the specimens that are turned in are coming back as B117. When we look at Georgia, it's even more than that. That was about a month ago of data that we've seen. It was at 65%. This is a more contagious variant and sometimes thought to be more virulent. So it is beneath our feet. They are gaining ground. So it's very important that we do not just give up on what we're doing at this point because we made a lot of progress. Next slide. This is kind of throughout the country. You can see the different variants, and number 4 is where Georgia is, and you can see that B117 and the percentage that it's representing. So we definitely have a big problem back here in the southeast. Next slide, please. This is just reiterating where we're at. We're still at high transmission in the state of Georgia and also with Cobb County. So we need to continue to fight back this pandemic, and you still have to get tested if you have symptoms or come in contact if you're not, especially if you're not vaccinated. We are still seeing outbreaks, we're still seeing them in the schools, and we're still seeing them in businesses and in different places. So it is definitely not gone yet. Next slide, please. You can continue to get tested for free at Mako at Jim Miller Park. Your insurance will be charged if you have insurance. Otherwise, you don't have to pay out of pocket. This is the main site that we have that's offering free safety net testing, and there are many other private providers. But just in case you needed a free option, this is the one we have. Next slide, please. Here, let's talk a little bit about vaccinations. And so you can see the state of Georgia has 36% that had the first dose and 28% that are fully vaccinated. We give a big shout out to Cobb County that we have 39% of the first dose and 30% fully vaccinated. So that's great. We're ahead of the state, and we're ahead of the metro as well when we look at vaccination rates. But 30% is still not enough. And so we do have to continue to. Yesterday, you might have heard that 12 to 15-year-olds are now approved for the Pfizer-BioNTech vaccine. So we are offering that right away, immediately at all vaccine sites. So we have to keep going with this. Next slide, please. Here are just some of the benefits, things that you can do. You can go to church with your vaccination and feel safer, and just make sure you wear your mask. You can go indoor dining. You can gather with friends, even some friends that are unvaccinated. But it's much, much safer if you get your vaccine, and you're putting less people at risk as well. Next slide, please. You can get all kinds of appointments all over the metro and the state. You can just walk up to our Jim Miller and Arbor Place Mall sites and get vaccinated. Next slide, please. And so here's Jim Miller and Arbor Place. Next slide. And we do have the core option too. So this is more of a little bit of outreach. They're going to different sites. So you can go, and if there's something closer to you, you can go to them and get your vaccine there as well. So here's the schedule for this week, and then we can provide these if anybody needs them. And then next slide. Here's this is our outreach team, very busy. They go out to different places. You can see them at the Zone. You can see them at St. Thomas Cathedral, Kenyan American Church, so different places that you can get vaccinated. And we're trying to get more into communities that are harder to reach and provide a little bit closer vaccination services. Next slide, please. And you can call the call center. There's going to be lots of questions, and so you can call and get your appointment there or ask questions of them about COVID. Next slide. There is a Lifting United Way. I wanted to make sure that everybody was aware that you can dial 211 and you can get a free transportation to a vaccine site. So that's kind of exciting. They also have a lot of other things that they offer, and COVID has really taken a toll on our community. You can get anywhere from counseling to help with rent and housing, and you can also just dial 211 to get an appointment to vaccine services. Thank you. Next slide. So the takeaway here is that we, excuse me, we continue to have variants that are really rising beneath our feet. The Indian variant that originated there is in the United States as well, and you all see what's happening in India right now. We still have a lot of cases, and a very large number of variants are coming through. The concern here is that we need to, we've all talked about herd immunity and about getting vaccinated. 30% is not high enough. If we continue and we let the virus simmer beneath us and have outbreaks and continue to kind of let it go, that's breeding ground to have a new mutant that will come out, or a new variant. And so the one thing we don't want is we don't want to have a variant that is resistant to the vaccine. Then we're in a lot of trouble. So the vaccine is very safe, and we just all need to get vaccinated. There's a new study that came out that's showing that transplant patients are not mounting a response to the vaccine. And so that's important. This is a group of patients that are immunosuppressed that cannot mount a response and be protected by the vaccine. So it's our job as a community to protect the most vulnerable of folks. So it's our young, our sick, and those that cannot get any protection from this vaccine. So we need to do it together and protect everybody. So please get your vaccine as soon as you can. Don't wait, and a lot of people are waiting and saying, oh, I had COVID, it's fine. You can get COVID, and the immunity will not last forever. So get your vaccine. You can get it soon after you recover from COVID-19. So please, we're almost there. Let's all get our vaccines, and we'll get to the finish line on this. Thank you. I'll take any questions if you have any. Sorry, I should be addressing you instead of...
Oh, no, please, the public is who we want to have the information. Commissioners, do any of you have any questions this morning? I have one question.
Yes, ma'am.
The percent vaccinated, is that of the eligible population that can be vaccinated, or is that the total population?
Actually, it's a great question. It's actually the total population, and
Okay.
so when you go deeper into those data slides, you'll see that of the more of the population that we have, if you look at like the elderly population, you'll see much higher rates of vaccination, and then it'll trickle down. And so that is a great question.
Very good. Thank you. We
very
appreciate having
welcome.
you here today.